Caregivers can use multiple different techniques to identify child abuse. One is talking to their patients, talking to the families, and doing a physical exam. One thing that physicians can use is what's called the bruising clinical decision rule. It's more commonly called 10-4 faces P. 10-4 faces P is a validated tool to use in children less than 4 years of age to identify which children, if they have bruising in these areas or injuries in these areas, which children need to have further medical evaluation. 10-4 faces P doesn't diagnose child abuse, but it helps to identify the kids who need more of an evaluation. And 10-4 faces P stands for, the T in 10 is bruising to the torso, so that's chest, abdomen, genitalia, back, and buttocks. The E stands for bruising to the ears. The N is bruising to the neck. And then the 4 stands for a bruise anywhere on an infant that's less than 4.99 months old. Faces stands for, the F stands for a frena or frenula tear. We have 3 of these in our mouths. They're little pieces of tissue. The A in faces stands for bruising at the angle of the jaw. The C in faces stands for bruising to the cheeks. And the second E is a bruising to the eyelids, both the upper and lower eyelids. And the S stands for subconjunctival hemorrhage. So that white part of the eye having a little bursted blood vessel in it. And then the P stands for a patterned bruise. The bruising clinical decision rule is that if an infant or child less than 4 has any of these things, unless these injuries were caused by an independently witnessed event, in other words, something that happened in public that was seen by multiple people, that child needs to get a non-accidental trauma workup.